Hello everybody. For my microbiology presentation, I was given the topic of urine. With that, we're going to talk about urine cultures, why we run them, what follow-up care looks like, how we get the sample for them, how that sample is sent out, and then our clinical signs. So we'll start with clinical signs first. Basically, it's going to be any of your UTI symptoms. So that's going to be frequent urination or plaquuria, dysuria, marking or straining to go, as well as urinary accidents, urinating in inappropriate places. A lot of animals, you can also see cloudy urine, foul odor, and sometimes some hematuria as well. A lot of animals may also lick at their urogenital areas, cry, vocalize. Some animals may also not show any signs. Their symptoms will be minimal. And that's why when we do a urinalysis, if it has a presence or suspect presence of bacteria, it should go up for culture to see exactly what that bacteria looks like, if it's antibiotic resistant to anything. Here at Bay East, really anything that does have that presence or suspect presence of bacteria, we do recommend a culture for. If the owner is cost conscious, we will send home antibiotics first, see how that goes, and then recheck or do a culture if the antibiotics don't really help much. Along with that, we do like to recheck a culture afterwards to make sure that bacteria is gone and to make sure it didn't develop any resistancy to the antibiotic we were using. Next, we'll show you how to collect urine on a cat. Okay, for our cystocentesis, we have Tigger here, who's going to be our patient. Tools-wise, we have a 3 ml syringe with a 22 gauge needle on it, a white top tube for our sample, and then some alcohol to prep the area, and then a well-versed technician. So I'm going to put Tigger into lateral recumbency. Come here, baby. No. And I'm going to pull her back legs. Make sure her tail's not in between my legs. And Kelsey's going to palpate the abdomen and feel for a bladder. There it is. Should feel like a little water balloon. She's going to put a little bit of alcohol on the injection area just to make sure we keep sterile technique. Good girl, Tigger. And she's going to poke. Perfect. She drew up about 3 mLs of urine, which is more than enough for a culture. Typically we need 1 ml tops is what IDEX requires. So to collect urine on a dog, it's a little bit different than how we collect on a cat. Cats as well, I know we just showed you how to collect by palpating. If it's a chunky cat or a cat that we can't really see the bladder to or feel the bladder too well, we will put them under an ultrasound probe and look that way, kind of the same way we look in dogs. Speaking of how we look in dogs, up next I do have a little video with one of the doctors from Lakeland Veterinary Imaging, Dr. Brianne Miller. She's a vet that comes to our clinic quite frequently for referral ultrasounds. She'll bring her supplies and her technicians. We'll do ultrasounds on our patients and give our doctors a full report. So she was gracious enough to kind of give me a walkthrough on what she was seeing and on her process of doing it. So enjoy.
So it's got this layered wall and the urine is dark black. And this is the trigone. His prostate is right here. Normal size for a neuter dog. And this is in long axis, so cranial, caudal. I can turn my probe sideways, right, left, so that's just short axis, and just scan through the bladder. So really what I'm looking for is this layered fluid-filled sac in the right anatomic location. I'm using a curvilinear probe, so it's a smaller footprint probe. And then I don't have to move the probe too much to get to my needle. So I just try to make the bladder as big as I can. And then I guide my needle, and if you need the lights on, we can turn the lights on for this. Right in the middle of my probe, behind it, and then if you look at the screen, the needle is coming from the upper right-hand corner. It's a bright white line. There it is, right at the edge of the bladder, and then I stick it through. There it is, in the bladder. You can see a little bit of the hyperechoic, intensely hyperechoic echo in the bladder wall. And then pull back the plunger, getting pee. Lots of pee because the lab likes urine for urine cultures, and got all that. And then I will leave my probe here and you can see me pull out my needle.
Once we get our urine sample, we're gonna label it. So I have this labeled. It says Tigger Tilkins, who's the cat that we did a cystocentesis on. It has the date, so 10:30, which is the date today, and then the time, which is 9:03 a.m., which is when this was drawn. On the bottom, I have what's in the tube, so urine, and then via cysto. And you might be asking yourselves, what does that culture look like when we send it out? Here at my clinic, we don't do any cultures in-house. Everything goes out to IDEXX. But if you were to run a culture in-house, what's that gonna look like? So you're gonna start with your agar plate. With that, you're gonna take your sample on a sample swab, and you're going to, just like we learned, kind of like that, and then turn and go down and turn and go down and turn and go down until your entire plate is covered. With that, after that's done, they will take so a lot of the cultures that are ran with urine are susceptibility or antibiotic resistance. I'm looking to see if there's any antibiotics that are not going to work with this specific bacteria we have. So they have a machine that comes with a bunch of different antibiotics on it, stamps it onto that agar plate, and then as the culture goes, and it takes about 2 to 7 days to finalize results on that. You can see how the bacteria looks, and if it's, if there's a ring around it. Another good example, so this sample would be considered resistant because the bacteria is on the antibiotic little cell it put in. This one would be semi-resistant because you're measuring the area between the cell and then where the bacteria starts its growth. This one would be something that would be sufficient in giving that animal to get rid of that bacteria, having a large enough circle, and that just shows us what the susceptibility looks like for the bacteria. Treatment options after a urinary culture is going to be mainly antibiotics. A lot of the times the dogs that we do cultures on, they've already had a urinalysis where we've already put them on an antibiotic. So we're really seeing if that antibiotic matches what the culture shows. Say we put them on amoxiclav, but amoxiclav is resistant. So we're going to change their antibiotic to something like enrofloxacin, which is going to be a little bit more effective than the amoxiclav was. Along with that, here at my clinic, what we like to do is recheck a urine culture after the antibiotics have finished. So typically 5 or 7 days after the antibiotics are done, we'll recheck a culture, send that out, and make sure there's no growth. Along with that, if the bacteria has developed a resistancy to the antibiotic we switched to, say again, we switch from amoxiclav to enrofloxacin, and now that bacteria is enrofloxacin resistant, then we can change up our game plan again and go from there. And thank you everybody for your attention. I hope you found this video interesting and maybe a little bit out of the norm. If you have any questions, feel free to let me know. And have a great day.